Welcome, everyone. Thank you for joining me today. Dr. Ahmed will not be joining us today. I'm Theresa Marentette, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 719,751 confirmed cases of COVID-19 in Canada and 242,277 cases in Ontario. Chatham-Kent has 1,028 cases, and Sarnia-Lambton has reported 1,675 cases. Michigan now has 540,115 cases, with 27,770 cases being in Detroit. Today we are reporting 116 new cases of COVID-19 in Windsor and Essex County. 13 cases are close contacts of confirmed cases. 9 are related to outbreaks, 1 is community acquired, and 93 are still being investigated. We have had 11,346 cases of COVID-19 since March. 8,650 people are now resolved, and 2,419 people are active cases at this time. 112 confirmed cases are currently in the hospital and 18 people are in ICU. We are reporting an additional 6 deaths today. 5 people from long-term care and retirement homes, a woman in her 70s, 3 men and a woman in their 80s. 1 person is from the community, a man in his 70s. I'm so sorry to be reporting deaths this way by gender, place of residence, and age. We know their lives cannot be captured in a few words, and our hearts do go out to their family and friends. Our community has lost 277 people to COVID. 186 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 52 active outbreaks in Windsor and Essex County. 19 are in long-term care and retirement homes, 26 in workplaces, 2 community outbreaks, and 5 hospital outbreaks. We continue to work with our long-term care homes and retirement homes regarding vaccinating residents, staff, and essential caregivers. We are monitoring our vaccine supply very closely and have had to reschedule some second visits to homes. Due to ongoing outbreaks in long-term care and retirement homes, all people were not able to receive their vaccine on the first visit. Despite the rollout of vaccine, please continue to follow public health measures. Stay home if you're sick, limit your close contacts to your household members only, maintain a 2 meters distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, wear a non-medical mask or face covering, and cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
Hi, yes, you talked about having to reschedule some of the visits. Was this for the first vaccine or for the second round vaccine? If it was for their second round, how does that affect the effectiveness of the vaccine?
So our vaccine that our health unit is administering in the long-term care homes and retirement homes is Moderna. And so our second doses of Moderna will start on January 28th. So right now we have only been giving first doses, and due to outbreaks, we've had to kind of stagger the time when we can give people their vaccine based on their recovery from COVID. And so we do have one retirement home that has not had a first visit yet. We hope to visit them tomorrow and provide some limited doses of vaccine for first doses only. Until our next shipment of Moderna comes in, we're really monitoring the vaccine supply carefully to ensure that we can start our second doses on time, which is 28 days from the first dose.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Theresa. We know there's still this backlog of contact tracing just based on Dr. Ahmed's Friday presentation with the sources of transmission for the most recent cases. Based on the resources that you were able to get from the province and elsewhere, how is that workload going for public health?
We're making good progress, and we are improving our times in contacting people. We're making first contacts, not complete interviews on the same initial phone call, but we are contacting people, and the resources have helped a great deal. We have really, made some good progress. So the case and contact management, while the numbers remain high and there are lots of contacts, the increased resources have helped tremendously, and people are, being contacted and given information about isolation and staying at home pending a further interview by us.
And at this point in the pandemic, what is your biggest focus? What's the biggest thing on your plate right now?
The vaccine rollout. That's all I've been doing is focusing on our strategy here in Windsor-Essex County. There is a plan that is due to the ministry today, and I've been connecting with our healthcare partners, our community partners, to really determine the scope and breadth of our vaccine rollout so we can be ready and prepared when we get a regular supply of vaccine.
Is that the kind of work you've been doing while Dr. Ahmed has been taking over the presentations in the morning? I know there has been some reader speculation about where you went.
Oh, well, I haven't been anywhere except my house, and I'm just working remotely to get this plan submitted in a timely way. I've also been working very closely with the ministry. Every day there are several meetings, and we're really reconciling our data. The vaccine has been, basically all I've done. So we can put the speculation to rest, because I have not gone anywhere through this whole pandemic. So if I'm not here, I'm at home.
Thank you.
Any questions from AMA 100?
Theresa, with the delays for the vaccine, is that going to impact the remaining, I'm not sure if you said this already, remaining retirement homes that need it? Is there still a number in our area that still need the first dose? So
we have one remaining retirement home that has not even had a first visit from us, and that was due to an outbreak. So we will be visiting them tomorrow and offering some limited vaccine. Even though we've made first visits and we've done a really good rollout, we will be making sure that any resident any resident or staff or essential caregiver, once more vaccine comes and we're able to, that everyone is vaccinated who wants to be vaccinated. So every home has received a first visit from us except one retirement home, which we hope to get to tomorrow. There are also more homes that need first doses, but due to our vaccine supply, we have to reschedule those until we actually receive our supply and can make sure we have enough vaccine to provide the second doses. And, our next vaccine shipment is due at the beginning of February.
Theresa, 3 weeks it's been since the Moderna vaccine has arrived in our area, since the vaccinations begun. And I know you talked about this last week or the week before when long-term cares were all done. And just to get basically 44 homes done in our region in 3 weeks' time, what goes through your head? Because like you just said, you're doing a lot of work here. It just seems like a very remarkable accomplishment.
Well, that's exactly how I feel. It is remarkable. And to think that 3 weeks ago, like today's the 20th. So yeah, 3 weeks ago, we have done a lot, our nursing staff, but a lot of people behind the scenes to make sure the delivery of the vaccine, the reconciling of the vaccines. So we know that Windsor Regional Hospital is also giving out the Pfizer vaccine to staff as well. So, you know, our combined efforts, we've done a great job, and, you know, we just want to keep moving, because if we can protect the residents and the staff in the long-term care homes and retirement homes, like, that is huge for our area. We've been hard hit. All of the retirement homes and long-term care homes in our area have gone through a lot through this pandemic. So I can only imagine that the vaccine offers some hope and some relief for them. So yeah, just want to keep moving and want to get, you know, more vaccine.
And one final one here, kind of going off Maureen's question, but if an individual does not get that second dose within the 28-day time period, how, I'm not sure what word to use here, how will that work out? Like, would the first dose even work for them then?
There is protection with one dose, but we are following, for Moderna, we're following the recommendations by the pharmaceutical company, and it is 28 days. So I know Pfizer is different. We're not administering Pfizer right now from our health unit. So if the timing all lines up, we'll be in a good position. So if we have a certain amount held back until what we anticipate to be our next shipment, and that amount that we're holding back should be enough to give the second doses on time, and anticipating that that when the new doses or the new shipment comes, we'll be able to continue on with second doses, and also provide some first doses again as well.
Thank you.
Any questions from CTV?
Yes, good morning, Theresa. I hope you get that vacation soon. So I want to talk about the Pfizer vaccine, because I know you guys deal with the Moderna, but I heard the shipment of Pfizer vaccine isn't going to be delivered by the end of the month. So I'm just wondering, like, there's been a change in the provincial vaccination plan. Will that affect what happens down here? Will that trickle down here?
The Pfizer vaccine is being given through the Sportsplex, through Windsor Regional Hospital, and they have been they've been administering the vaccine for quite some time as well. And they have been giving the staff and the essential caregivers vaccinations in long-term care and retirement homes on site, at their site. So the fact that Pfizer, there's a delay, and shipments have been canceled, it does impact the amount of first doses that we are able to give to the remaining staff in long-term care and retirement homes and the remaining essential caregivers. So pending a steady, reliable shipment of both Pfizer, Moderna, whatever vaccines available to Canada, we're making changes and doing the best we can. So there is pressure on Windsor Regional as well, because they do have Pfizer, and the province has asked that we all work together. But we know that our supply is, that our supply locally, we've got pretty well every dose accounted for right now. So we have to wait for the shipments.
So how low on the vaccination, maybe like from your perspective on Moderna, and I'll get the hospital answer on Pfizer, but are we running out of doses? Because I know there wasn't a boatload to begin with anyway, but I assume we're running really low right now.
I would say, yeah, that's accurate. We are, we're monitoring it really closely. So we do, we can't give everybody everything they need at this time. So some of the homes that are ready, as I said before, homes that were in outbreak, they had to kind of pause until people got better. So as those people get better and they're asking for the, us to come or for the vaccine so they can immunize their, whether it's a resident or a staff member or essential caregiver, we've had to ask them to wait for our next shipment. So it's not a cancellation of the dose, it's a rescheduling of the dose to ensure that we have enough to begin those second doses. So it's a fine balance.
Yeah, oh yeah, for sure. Now, like, is this going to become a problem later on when we get into, perhaps residents getting this vaccine or this vaccination done? Like, do you foresee that being a problem if it's, becoming a problem now?
I'm going to be optimistic and say that when the vaccine is rolling regularly and out to the general public, that it'll probably come very quickly. And so part of our plan locally is to be ready and able to vaccinate when, big shipments do come. If that's our problem, that'll be a welcome problem.
Okay, great. Thanks, Theresa. Appreciate your time.
Any questions from CBC?
Hi, good morning. Yesterday we learned that an investigation is underway into the death of a retirement home resident who passed away after receiving the vaccine. Now, I know you're limited in what you can say about the situation, but is there any more information that you can tell us about what might have happened there?
I'm sorry, I can't really speak to it. It is being investigated, and there's nothing more I can really provide.
Okay, thank you. I also wanted to ask about the cases that we're seeing in the Agrifarm sector. There's 11 outbreaks right now. Wondering if you know how many cases there are and what your concerns are at this time.
I saw the breakdown today, and I know at 11 o'clock we get an overview of all of the cases. So I'm not completely informed about all of them right now. As I said before, I've been pretty involved with the vaccine, so I'm not really up to date with the specifics of the number of cases at the farms, but can make sure I have all of that for you tomorrow.
Thank you.
Any further questions from Blackburn?
Yes, sorry. Just on regards to the kind of vaccine shortage that we are now kind of experiencing, does that make it kind of more frustrating that maybe some people may have got it that maybe shouldn't have, or that now people that should have gotten it are now having to wait because there's not enough in the community?
Well, we just have to move forward with what the situation is right now, and I know that we have done a great job with the vaccine in the long-term care and retirement homes, and are using it for those that are most vulnerable, and I'm happy that that's occurred.
Thank you.
Any further questions from the Windsor Star?
No, thank you.
AMA 100?
Theresa, I'm not sure if you can answer this, but within the 44 long-term care and retirement homes, can you tell us how many residents, staff members have received the Moderna vaccine?
We have everything tracked. I don't know if we have complete numbers by home because the Pfizer and the Moderna have different tracking systems. But I know we are working on that. That's one of the key, kind of areas that we're wanting to be very accurate with. So we are tracking everything. We're entering it into this COVAX, the ministry's COVAX system, and reconciling that. So I can't confidently say that everything's been entered into the COVAX system. So whatever we can pull right now may not be as accurate as if everything was entered. So we are working with the homes that we know where there are outstanding people that haven't been entered into the system and trying to get as complete data as possible. And I know the ministry is wanting this. So we're, locally we have estimates and we know exactly based on the doses we've given out, but we have to confirm that in this COVAX program. So I don't have that information now, and I know the ministry has been asking us to not share information that's, not completely accurate, and so we're getting there.
Okay, and then going back to what we talked about in the first round of questions, will we be the first region in the province to have all long-term care and retirement homes done? Have you heard any other regions that are close to what you and the team have done?
Well, the other pilot sites are working hard as well, and I don't, like in saying done, the definition of done would mean that everyone that wants the vaccine has had it. And so in Windsor and Essex County, because of the outbreaks, there are still people that want the vaccine and they haven't been able to, get it yet. So when everyone's done, that's different than saying we've been to every home and have done a first visit, a first round of vaccinations. So I would say that we're not done yet. There's lots of work to be completed to make sure everyone who wants the vaccine has access to it. I think we've made great progress. We've touched pretty well every home except, like I said, tomorrow we'll go to the final retirement home. But there's still more work to be done, and we hope to do it. We will do it, and because this is a vulnerable population, we want them protected as best we can, and the vaccine is the best option. And there are people in these homes that still want the vaccine, and because of the shipment or the supply, our allocation, we've had to wait. So we'll get there. We're just not there yet, but definitely great progress. Like you said, 3 weeks ago, we didn't have anybody, even thinking about getting the vaccine, and now so many have had access to it.
Thanks, Theresa.
Any further questions from CTV?
No, I'm good. Thank you.
CBC?
Sorry, nope.
Okay, thank you everyone. Have a good day.
Thank you.